It is January 13th, 2021, and I want to bring you into coronavirus inside the Arizona numbers. We help you decipher some of the data coming out of the state of Arizona. We'll have lots of numbers to go over. We'll hopefully try to explain to you where to find things if you need to look for them when we're not here with you, and just help you make sense of these numbers so you can make the best choices for your family and your life. I want to say we'll start where we always do, Garrett, but on this particular day, you have some personal news to share.
Yes, I tested positive for COVID-19 yesterday, so I am.
You're quarantining.
I'm part of the statistics now. I'm part of the case count.
But important to note, you're at this point feeling okay.
Yes, yeah, I'm feeling great. I have. I can't smell anything. I can only taste a little bit. I was just talking about how coffee no longer tastes like coffee.
Yeah.
It tastes like tea, which is not fun. But other than that, I'm very fortunate in that I'm not really showing any other symptoms. So I'm crossing my fingers that it continues to progress that way.
Yeah, fortunate in both age and health, as we have seen. It's not been the case for so many families across the state of Arizona. But we're glad you're doing well. I also want to mention your wife and child are okay at this point.
Yeah, we're
testing negative.
I've got 2 rooms in the house, and they're fine right now.
All right.
They haven't tested positive. They're not. In fact, they actually went to go get tested today, and the nurse was like, "Nah, you have to wait for about 3 or 4 more days before we test you, because it's a likelihood that you would test negative at this point." So they want to wait until it would be verifiable at that time. So they're going to get tested probably either this weekend or Monday, and we'll see what happens then. But hopefully, fingers crossed. Like I said, we're kind of staying away from each other. So
this symptom, if you will, of no taste or no smell really is a leading factor, it seems, for folks right now. I mean, after maybe seeing people over the holidays or being together or things like that, that is one of the things that's cropped up early for folks. So we wish you well.
It's I don't have any sinus pressure at this moment, but it's sort of just the fact that it's kind of surreal that I can't smell anything, and it's just not a sense that you're that you're used to having. So we'll see. As I said, I'm drinking warm drinks and staying hydrated, and fingers crossed, everything seems to be okay right now. So hopefully that continues that way.
Yeah, it's got to be a strange feeling, though, to be a part of the numbers that we've covered here for so long, and we always stress that we always talk about how we keep the people in mind who are disproportionately affected by this, and to now be one of those. I know that Garrett, this is not something you had to share with our friends on here and the people that we've gotten to know, but you felt in the spirit of transparency and letting people know that it was the right thing to do today. So lots of very sweet comments coming in for you. You've guided a lot of people through these numbers since May, June that we've been doing this. So a lot of well wishes coming your way. All right, let's get into the numbers as we're seeing throughout the state of Arizona. A lot of high points, high numbers coming in today. I do want to mention, when we're looking at things overall in the United States, sadly, we just had the worst day for U.S. deaths, but there is some hope in all of this that in June things could be considerably better by the summer. So we'll talk about that throughout this time that we have here this afternoon coming up. Obviously, vaccinations are key to that. Let's though start on the summary page, as we always do, with some of the numbers that are coming out of this state here.
So today, the number of new cases that were reported today, I'm going to try to get this a little closer here, 5,629 new cases, and the number of deaths was 191. I'm focusing mostly on that. I don't really focus on the diagnostic test right now, although as you can see, it's only about 15,000, 16,000 tests. We've been seeing a lot more cases coming with a lot less tests. Our testing is keeping up week by week, but we're not seeing a growth in tests right now. Pretty much we're seeing more of a leveling out of tests. So what this does for our 7-day averages, our case average is at 9,578. So essentially for the last 7 days, we've added about 9,600 cases to the case count on a daily basis. That's the 3rd highest it's ever been. The death count is at the 7-day average for deaths is at 175. That is the highest it's ever been. And then our testing average, like I said, is at 22,000, which is very low at the rank of 57. But so this is where we are essentially. We're seeing a slight drop in things today, but again, this is only really a slight drop and more of a reporting artifact than anything. we're seeing, as far as our week-over-week case growth, we are seeing it, and for the past 5 days or so, it's been in the single low digit, or today was single digits, 5% week-over-week growth. The last 5 days, it's been as high as 14%, but essentially it's been going down. So what that means is that we are now starting to see sort of a slowing of the number of cases that we're reporting on any given day. We'll go to the case metric right here and show you the weekly case numbers right now. And this is what I'm talking about. You can see that between December 27th and January 3rd, even though there will be more cases added to these weekly numbers, you can see they're sort of twins here. We're not seeing sort of this exponential growth in cases right now in these 2 weeks. And so although we only have very few, we have very little data added to January 10th, but as we've talked about, this is an epi curve, and this number will continue to increase till it gets to about here over the next couple of days. But what we're seeing right now, as I said, Katie, is it looks like it is a slight sort of slowing of the growth right now.
I know we're looking at week to week on this chart. Jade just had an interesting question that producer Carrie popped up for us. Is there anywhere that's got this broken down in month to month comparison, maybe for the state of Arizona?
So we can actually go one more level on this chart itself. There's these little buttons down here, and this is the DHS dashboard, and you can see these little 2 buttons. And if we click this button one more time, we can go to a month-to-month comparison. And this is what we're seeing in the November, 103,000. You can see it more than doubled in December at 214,000. And then right now in January, we're at about 70,000. So obviously, since we're only about halfway through January, there's no question that we are going to pass that November number of 103,000 by not double yet, but at least by half. And then very likely will be in that 200 range. Now, will we pass 214,000? That remains to be seen. I have no idea yet if we're going to pass that 214,000, but we are definitely on track to pass that November number, no question.
So when we're looking at this, Garrett, obviously this is a chart that refers to cases. Do we see, is there anything similar to this that then overlays the deaths in there?
I can also look at the death chart and give you the same numbers. However, as we've talked about before, deaths will always
lag
anywhere from 18 to 20 days after a case, if that is the outcome of the case. So, but we can do the same thing. This is the epi curve for deaths. And we can bring it down one to see what they are on a weekly basis. You can see that we've been averaging approximately 700 deaths. It has been going down, but you remember as we get farther out, these numbers climb. So it's the closer you get to the day for deaths, the less the data is accurate. So we really want to look at these two right here, December 20th and December 13th. You can see they're in the 700s. This one will likely get to the 700s and probably surpass it because as we've talked about, deaths will always go about 20 days afterwards. So this is what this looks like. And then if we take it down to the month, we can see December, 2,888 COVID-19 deaths in December so far, 932 in November, right now 600 in January. But as I said before, this will absolutely pass the November number, but we won't even know if this January number passes the December number until middle of February, really. It's going to take a long time to figure out what that number is.
So just so everybody remembers that this is an epi curve, so those dates are plugged into the date of death, not the date that they have concluded the investigation into the death to say that is indeed a COVID related death. So one of the things to note as we're looking at that. Okay, we're getting so many questions about vaccines, and we will for sure get back to that in just a moment. I do want to touch on some of the hospitalization numbers that we have here in the state, because one of the concerns is, will I be able to receive care if I need to go to the hospital at this point? How do things look?
So we talked about this just briefly, but we are basically still at peak numbers. We did not hit a peak today, though. It's a little hard to see the COVID-19 numbers, so I'm just going to focus on the head counts for these, and then we'll move to the COVID-19 numbers. So as you can see, the hospital systems, we talked about this, ever since basically the end of December, they've been, this is the ICU numbers, they've kept the numbers at around 90, the head count, if I were, the head room, 7% to 8%. So they're trying, it's basically our ICUs are anywhere from 91 to 93% full. Now we've talked about before that this is licensed capacity, not staff capacity. So there could be a reason as to why we're seeing this sort of the ceiling of 92, 93% is simply because they don't have the staff to go to 100%. But whatever the answer is, this is what we see. We see about 15 days where it's been sort of static at that amount of headroom. And we see the same number with the ICUs. We see they're about 90, or excuse me, inpatient, 93 to 92%. Essentially, they're keeping the inpatients full at that number. And one indication as to what that might be doing to the system is with the emergency beds. Now, this is COVID-19 agnostic. This is just people who are in emergency beds at 5 p.m. And you can see this number has actually risen gradually. It seems like it's having a slight slowdown right now, but it's been rising gradually as people are basically being queued, if you will, into the emergency room department, waiting for a bed to open up in inpatient or ICU or whatever it's going to be. So when we go to the actual COVID-19 numbers, hard to see because of all of these numbers here, but you can see there is a slight decrease in the number of inpatient COVID today. It went from 5,082 to 5,055. Ventilator use, it did, I believe, go to a record today at 805. ICU also went down slightly at 1158. And then the discharge number is at 915. As we can see, we're still kind of hitting records in that number. The emergency department number is up at 2,085, sort of where it was the week before. It's sort of tracking. And then the intubation number is at 23, which is again fairly high, and that number, as we see, has been continuing to climb. So
yeah. All right. Let's get to some of the vaccinations, because I know that is our point of hope in all of this. The point to sort of turn things around. We do get updated on the numbers on how many people have been vaccinated here in the state of Arizona. Those numbers come to us in the newsroom in the early afternoon hours, late morning hours, and we can also tell you what counties are in what category all across the state. So just to recap the phase groups, we've already started phase 1. Obviously, that started December 17th when the very first vaccine was available to arrive here in the state of Arizona. Phase 1 is our healthcare workers and healthcare support occupations, any emergency medical services workers, long-term care facility, and residents. Some places are now in prioritized phase 1B. That is any of our teachers, our education and childcare workers. That's anybody in the protective service occupations and adults 75 and older, and then anybody that's remaining over for that 1A group. The third group that some counties are already in, and we'll go through all the counties for you, is phase 1B. That's essential services, critical industry workers, any adults with high-risk conditions who are in congregate care settings, and then any holdovers from those groups that we just talked about. So just because you might be in 1A and they're already moving to 1B doesn't mean you've lost your chance. It just means that they're opening it up to more people at this point. Okay, so
hey, Debbie is taking care of me in the comments.
She is. I saw that too. I had to smile. Yeah. Please tell us whenever you need to take a sip or take a moment. There's so much to get to that that I want to make sure you have a breath and a sip as well. So Garrett, there are two numbers that we're then tracking here in Arizona, aside from these groups, is the total vaccinations that have been given out, right, and the completed series. So for instance, I know of a few doctors, a few hygienists, I know them personally, who they have already gotten their second shot. Their series is complete, if you will. So
so this is the total administered vaccine. This is what we're looking at. This particular table doesn't care if it's your first or your second vaccine. And so this is where they are with total vaccine administered. The phase of vaccination is where that particular county is. You can see the majority of counties are in priority 1B, although we do have some counties that are in the full 1B, Navajo, Pinal, Santa Cruz. And you can see we've administered about 188,000 vaccines so far. I'm getting yesterday's number really quick so I can tell you what the difference is. I have that recorded. That number, as soon as I can get to it. Come on. All right, that number was 165. So we are now sort of accelerating the number of vaccines that are happening in Arizona, which is a good thing, obviously. We were talking about how our rollout has been so slow, but we're starting to see an acceleration. That's 22,000, 23,000 vaccines. That's up from about 14,000 the day before. So we are starting to see increases. Now what you were talking about, this is that where people are in their series. So, and what we're seeing is the ordered number is the number of vaccines that they have coming. Partial series are people who have taken their first shot, 170,000 vaccines, 171,000 vaccines that are in their partial series, and that's 100,000 of those are in Maricopa County. But the completed series, this is basically going to be, healthcare workers, because they're the only ones that are really eligible to be in that full, the completed series. And you can see about 17,000 people in Arizona are at their completed series, essentially.
Yeah. So while we obviously celebrate these numbers, and probably fair criticism that's come about is, why didn't we have this ready to go on December 17th? So when the vaccines arrived in the state of Arizona and really several places across the country. So it's going to be something that's looked at critically in the future that hopefully we can learn from. But in the meantime, the concern that people should have or could have been able to have been vaccinated a lot faster in that time from December 17th. I mean, we're nearly a month out from that now on January 13th. So that's the critical factor in all of this. The number to celebrate in all this is that we're, right now, with State Farm Stadium being open, able to really ramp up those numbers quickly.
Yeah, I was talking today with, there was a press conference with ASU Bioscience, and Dr. Joshua LeBaire is the executive director, and someone actually asked him a question about the vaccine rollout and what he thought of it, but then also about the new CDC guidelines. Apparently, the CDC just came out with new guidelines saying that they should actually vaccinate 65 and up instead of 75 and up being in this priority group. And what Dr. LeBaire did say is while there has been some wobbling in some cases with the rollout, he said for the most part it's gone fairly well in his opinion. I guess he went and got one in Chandler, and he said it was very good when he did it. But he did say that Arizona should consider revising its phases to include that 65 and up category, because as we've talked about, I saw someone say something in the comments about how healthcare workers didn't go and get their vaccine, and that's a good point. And one of the reasons why he said that, so if we open this up to a larger population, at least to step down another 10 years, you do have a larger population that is willing to get the virus, and that's one of the problems of stepping into the next priority or the next phase is, at what point do you say, okay, we have enough 75 plus that have gotten the vaccine that wish to get the vaccine? How do you know what that number of people is that wish to get the vaccine?
Yeah. Are you seeing
no? Yeah.
Yeah. Is it a slowing of 10% in appointment scheduling? What is it that denotes that?
Yes, exactly. So he said, considering moving it to 65 plus is probably a good thing, because one of the things that is a problem is, seeing sort of like we had with that population 1A, where there was a point where we were seeing, vaccination sites with no lines at all.
Yeah.
Because there was not enough healthcare workers that were willing to get vaccinated. So they're like, well, we have to move to 1B. So eventually, they have to consider doing that too, so that they can, not have that sort of dry spell where you have a certain portion of the population that are like, I'm waiting essentially. And like, well, we now need to get other people in.
Yeah. Okay. So Jade is asking, what I work in an essential industry, but I work remotely. How do I know if I qualify for 1B? So on the AZDHS site, they've got a section, and you can fill out the paperwork to see if you're recognized as that group, and what members of that staff would be allowed to head in for essential services and be part of that phase 1B. So I'm assuming Jade's in Maricopa County, could be wrong, but I'll use Maricopa County as an example. We're in prioritized 1B, and some other people were asking, okay, when do we move to full 1B for that essential workers group? It's anywhere from 3 weeks from now, so the beginning of February, all the way till like mid-March. Hopefully it'll be earlier than expected. Did they talk about that at all, Garrett, when they think that might happen specifically?
No, they did say, if I recall, they did say that he thinks that we'll be moving into the next phase in February. So I believe, I could be wrong, I'm sorry.
That's what
a lot of those odds for that today. So
yeah, no, that's exactly what we're hearing in line too. Obviously, there's no way to predict, and we're still just now getting the numbers and the raw data on how many people they're able to move through that site at State Farm Stadium, and that'll be a real strong indicator of how quickly we can move through these groups. If they're able to get like 200 people an hour or more, that'll be helpful in knowing.
If you go to and this is actually a recent change, if you go to the azdhs.gov website, just on their portal page, so just azdhs.gov, you can see they now have vaccine registration as the first bullet point So for anyone that is trying to see if they are eligible for the vaccine, you would actually click on that. It takes you to a different patient portal where you have to log in. You have to create credentials, log in. I'm going to just show you what that looks like. I'm not going to go
Yeah.
further because I'm not going to clog the system. But it takes you to this page right here, and you would then create a account from here and then see if you are eligible and what phase you're supposed to be in. And basically, that's how you would go through the process of registering to take the vaccine.
And there is even another chart that we can access on there. I'm wondering if we could show it. I think it's under the Find the Vaccine page. Let me click on that and see that you can actually see what some of the questions are. So it's basically got your workplace information and contact information, email through your employer. Some of the schools are setting that up separately so that they can get their staff vaccinated.
This FAQ right here?
You know what? It may be through Maricopa County that I saw it too. Yes. Okay. I believe that's a page. If you click through on the bottom, scroll down, you'll see the 1B section at the very bottom. And here it is, essential employees getting vaccinated. And then there's that request form, that essential employer vaccine request form. You can click through it, Garrett. It won't clog anything because it's just the viewing page right there. And it's just got a few things, a few questions in there, a contact information, and then they'll review where you are in this. So that's kind of a look at the form right there. Email address and sort of proof of where you work and a few other questions. One of the things, you bring up an interesting point with this, opening it up to the 65 and older group, because one of the sort of moral questions in all this, obviously many people are excited to go get their vaccine, but there is also a level of, maybe you're an essential worker, but you're thinking, I would really like to see my parent who's over 65, but not over 75, be able to get the vaccine as quickly as I am. And that's been one of the conversations for people too, who say, I fall in this category. I want to go get mine, but I feel like I would be morally taking it away from somebody who's over 65. And if I got it and I'm taking every measure to protect myself, then that might not be a fair thing for them when I could have a reasonably good, hopefully healthy outcome, and they're, arguably in a higher risk category, and they want to give it to them. So opening it up for that whole group would then take that sort of moral guilt feeling away to make everybody be able to go get signed up for it. Okay, let's talk about a few other things in all this. If there's any other vaccination questions on there, we can try to get back to them, or really take a look at the questions and answer page, both in Maricopa County and the AZDHS site, because there's a lot of things answered in the top questions there. Really, of note, I just want to mention this really quick because we always kind of talk sports and all this. The Suns game tonight has been canceled. They don't have any players right now who have tested positive, but of course they just played the Wizards, I believe it was, and they had a bit of an outbreak, or a few players testing positive. So now that's 3 NBA games canceled for tonight, including the Suns. So just wanted to pop that in there real quick, make sure we talk about that as well for anyone that was looking out for a little distraction for all that is going on this evening, to try to think about something else and watch a game. The other sports headline that came in overnight is that the Waste Management Phoenix Open has trimmed the number of fans that they're going to allow in. They had said, people would be allowed to watch the match. They're only going to have 5,000 fans per day now out at the TPC. So they're going to modify the 16th hole. A lot of other changes coming. I'm sure it's not the last bit of news that we'll hear before they get ready for the Waste Management Phoenix Open, but a few sports notes in all of that. Okay, let's see, Garrett. There's been a lot of conversation about kids over these past few weeks. So many kids are at home, but they're still seeing sort of a strong amount of numbers coming out, and people are saying, was this families getting together? Because if the kids weren't in school these past 2 weeks, for a frame of reference, 2.3 million kids have tested positive for the coronavirus. 171,000 kids tested between December 31st and January 7th as coming in positive. That would then say it's a get together or exposure over the holidays, over Christmas or over New Year's. Where does that fall for Arizona? How do our Arizona numbers look? 12% of kids nationwide, or 12% of our cases rather, are ending up as kids. So 12% of our positive cases are showing up in in kids. I know Arizona splits it apart a little bit different, but we can at least walk our viewers through that.
Less than 20 years old, so this is going to, include some individuals that are not minors. We're probably going to pass the threshold of 100,000 in that category in the next day or two. It's about 15.5% of cases, cumulative cases throughout the entire pandemic, that are of that age group, that less than 20 years old age group.
Yeah, so just to remind everybody, with these numbers, again, under 20, that's the only numbers that come out of the state of Arizona. So that's the best we have. We understand that can include some college-age kids who might be exposed at a different rate, but just wanted to let you know. And what percentage was that, Garrett?
What's that?
What percentage is that 99?
15.
What was that? 15.5.
Yeah.
So we're actually higher in the kids category than what
and people look at this and they say, well, this makes no sense. Why would you do less than 20 instead of under 18? But you have to remember that this is an epidemiological scale, not a census scale. So when you look at that, less than 20, while it doesn't matter if they're minors or not, there's very little physiological difference between a 20-year-old and an 18-year-old. So they're lumped in together. And then that 20 to 44, most sort of the quote unquote healthy adult working population. And then you get to sort of where there's going to be a little bit more risk factors, 45 to 54, 55 to 64, more risk factors. And then 65 plus being the senior population with the highest risk in pretty much any epidemiological sense. Now, obviously, this one, it is, specifically for 75 plus, it's much higher, but that's typically how it works with epidemiology. And that's why they have these categories broken out the way they do.
Yeah, we haven't spent a lot of time on cases by gender, and since we're on this page, it's something we can take a little time to highlight. And 52% of women,
yes,
are what's showing up in this.
One of the interesting things about this pandemic is the case majorities are for women. 52% of women are the ones who have the cases. However, when you start to move into the hospitalizations and deaths, that flips completely and it goes to majority men. It's just one of those things that we've seen. And I know that there's a lot of studies going on right now as to why it seems that men are more adversely impacted of this virus than women are when it comes to sort of the worst outcomes.
Yeah, it'll be something that's obviously studied for years as we try to understand all of this a little bit better. And then some of those high risk categories, we see those broken apart on that page as well. Chronic medical conditions listed there for you.
So, exactly. So this is cases, not deaths. So this is what's in a chronic medical condition. Those are people that have a comorbidity. 16% of COVID-19 cases are in people that are in a high-risk category. 84% are not in a quote-unquote high-risk category as far as chronic medical condition. The highest risk, 65 plus or one chronic medical condition, about a quarter of the cases fall into the high-risk category, when about 3/4 of them do not.
Yeah, Amanda's saying women tend to be more willing to go get tested. That is something that we've seen.
Something to it. Yes, I think.
Yeah, it's something that we've seen all across illnesses and situations. It's one of the reasons that so many studies say being married or having someone in your life that's like, you got to get to this appointment, you got to get to your colonoscopy or whatever it is that's keeping you on track is also keeping you safe.
Exactly. We look at the hospitalizations just to kind of, we remember it was 52% female. Now, when you go to hospitalizations, it's now 53% male. So it's flipped completely, 53 to 47 in favor of men who are hospitalized. And then when you go to deaths, that number goes to 58-42. So there's a massive disparity in the deaths between males and females. And while this is Arizona, these numbers pretty much follow through for the rest of the country as well.
Yeah, match what we're seeing across the country. While we talk about the country, we are now approaching 23 million cases across the United States. For reference, in all of this, we have just passed 92 million globally. That means 1.9 million deaths compared to in the United States, we're at 383,000 lives lost, more than 383,000 lives lost. So that's families disproportionately affected by what's happened here. And of course, as we talked about earlier this hour, we are well past the 10,000 mark here in Arizona as we approach 11,000 lives lost in the next week or so.
I wanted to go over one comment or question.
Yeah.
Darnell Evans asked if Arizona has the two strains, and I'm presuming they're talking about the UK variant B117. And Darnell, I did ask that question. Someone did ask that question on ASU Biosciences presser today, because they had originally said last week that they had sequenced a pattern, a gene pattern that did appear to be the same as the UK variant. And so they sent it off for further testing, and they came back and said, no, this was not the UK variant. So as of right now, we have no evidence of the UK variant being in Arizona. That doesn't mean it's not here. It just means we don't have a sample,
testing sample,
sequence that has the variant in it right now.
Yeah, and obviously one of the concerns is being Colorado having it, California having it, Mexico having it, and we're right in the middle of all of this.
I mean, when we look at the numbers, for example, and we were talking about this, we've talked about how Arizona's the highest, COVID-19 case numbers in the United States. But let's just look at, hold on, I've got the 91 DVOC showed up.
Yeah.
So we sort of see this, and I'm gonna take Arizona out for now, and just focus on Ireland. Ireland, 45% of the cases in Ireland are the B117 variant. And you can see that line. That line is essentially, that is an exponential line in every sense of the word. And so you can see in the last, from 11 days, essentially, they went from 27.4 cases being added on any given day to where they were at their peak, at 132.7 cases being added. So that is a massive, massive change. And so when you see like Arizona, for example, for some reason it's highlighting Florida first. When we go to Arizona, you can see Arizona right now, we're basically in a race with Ireland. I know this is a race that no one wants to be in, but we're in a race with Ireland on who's sort of got the top COVID-19 new case growth in the world. And right now we're winning by a little bit. But you can see their numbers just exploded about 10, 11 days ago.
Yeah, and this is normalized by population, of course, so it's going to factor out any differences in population between Arizona and Ireland. As we're looking at 91 DVOC, I want to also be able to spend some time on the mobility charts, if any of those are updated, to show us how people are moving about or how things have been affected by. Obviously, the holidays play into this, but then also hearing this news has caused a lot more people to want to stay a little closer to home and maybe change plans. Also, word that you really need to have a negative test before traveling. That's made people change their plans as well. So how do things look?
Massive drops in mobility in the last, this data is a week old. I have it from January 7th, but you can see just massive drops from where we were in the middle of December all the way to now. It's just, we're getting to the point where our index is almost at only a quarter of where we were in March. It's going to be interesting to see where this goes. I know January 7th, that's pretty much outside of the realm of people who are still on vacation from the holidays. They've been, for the most part, most people finish their vacation on the 3rd, and they're back at work on the 4th, 5th, and 6th, that kind of stuff. And it does appear that we're now at a situation where we're outside of that window. And you can see that the mobility is still very, very low. So whatever's happening, people are not moving like they were during the holiday season and even during the summer.
And a lot of schools have decided to push back reopening. So here in Arizona, the scheduled opening would have been for many places January 4th. They've pushed that back to after MLK Day, which is January 18th. And so you would start back at school on January 19th. So we may see a change in that on the 19th as more people head back to school. Terry had a really interesting question just a minute ago, wondering how long, when you're going to get your vaccine, can you expect to be waiting in lines or getting your test done? So if anybody's headed out there, there's the comment. Would be helpful to know how long it generally takes to get in and out for the regional POD sites, that's point of distribution sites. For example, Glendale Gilbert Community College or State Farm Stadium. Really excellent question. And I hope that Terry's seeing some people are weighing in, and I just want to highlight this for everyone. Melissa Clark, thank you for replying to that question. Melissa writes that she got her second vaccine today and was leaving just 35 minutes after arrival. She also compliments their impressive setup. For those of you who are wondering where Melissa went, she also entered that for us too. Melissa, you're the best. She writes at the Chandler point of distribution.
That's actually the one that Dr. LeBaire said was really good too. So he was talking about the POD.
So if time is of a concern, which obviously it is for all of us in this busy environment, that might be the one to sign up at if you have a choice in that pull down menu when you're setting up your appointment. And, sometimes I think it would be faster at State Farm Stadium, but Andrea's writing in, a friend went today over at State Farm Stadium and it was about 90 minutes. So you see all those lines, you're hoping that they would move them through faster. Obviously 15 minutes has to be deducted off any number because that's how long they make you sit and wait after you get the shot.
I think my understanding is some of these PODs now there are different phases. So like Chandler, for example, might only be just that 1A. So they're still only taking healthcare workers. And then State Farm, as we've seen with all the flyovers we've done and all the other news stations have done, there's just cars everywhere. And so obviously you would expect, even though they've got so many distribution points, it would take a little bit longer. But it also has more people that are eligible to go there.
Yeah. Thanks to everybody who's weighing in. Everybody's kind of writing the time frames in there about different times that it takes. So thank you. So if you're interested in a few more times, a few more random sampling, if you will, you can find that on in the comments right now. And for those of you who are watching later on some of our streaming devices, head over to our Facebook page. That's where we read the comments each afternoon. So that's where you can find it as well. But some different times in there. Pamela writes, less than an hour at State Farm around noon today. Very helpful staff. That's the thing. I mean, whether you're going out to one of these testing sites or you're going to a vaccination site, I'm always trying to make sure that I'm thanking all of the staff who's out there. I know many are hired, but so many are volunteers as well. And if it weren't for all of those selfless people who signed up to do this, and this includes the ones getting paid too. I mean, there were so many unknowns in the testing, it had to be a scary thing at the beginning. So I'm just so thankful for all of them that work there. And I know so many of you are too, and passing that along to them, I know means a lot. Okay, where we rank as far as counties, we always say we're the 4th most populous county. So just to put that in perspective, we're a very large county here in the state of Arizona. For case numbers though, we're trending above where we should be. So where we should be, as matching our number, we should be 4 for each. For cases, we're actually in 3rd for counties. For deaths, we're doing a little bit better. We are in 5th place for deaths in the county. So just for a frame of reference on how things are being handled here in Maricopa County, that is sort of a helpful indicator. And then the states that were trending overnight with a vast increase in numbers: California, Texas, Florida, New York, and Georgia. So once again, California, Texas, Florida, New York, and Georgia. All right, Garrett, active numbers. That's what everybody's always concerned with. And I remember a day not too long ago when we had like 20,000. Now it seems we're approaching more than 200,000 active cases here.
It's the cases under 14 days, so yay, I'm included in that, is 100,730. Those are cases that would be pretty much in the most infectious period. And then cases under 27 days, which is what epidemiologists believe that it is pretty much the full extent of any sort of infectious range, is 198,244.
Yeah, so just quick math in that. If you have 641 total cases throughout the pandemic in the state of Arizona, a third could be active right now.
Yeah, and the others are pretty much that means that 2/3 of those 600,000 are not, they're not active anymore. They've already gone through it.
Yep. Yolanda writes, when will 1C start getting the vaccine? We wish we had an exact date. Felt a sneeze coming on there. You scare the sneeze away when you think, oh my gosh, I'm going to sneeze. When will 1C start getting the vaccine? 1C, I wish we knew the exact date. Obviously, we've got to go through, finish prioritized 1B. Again, Yolanda, I'm assuming you're in Maricopa County, but you could be in a different county. So check that specific chart that says where they are in the progress. But if you're in Maricopa County, we are in priority 1B. So we've got 1B full category next, and then 1C. At this point, it's anyone's guess as just how fast we can get this going. Likely, maybe early March in that sort of category. All right, I want to get to some more questions, but we're actually kind of running out of time at this point, and I want to make sure everybody knows where to find us. I don't know that we are going to be able to have an update tomorrow. Garrett, maybe you've heard otherwise, if you guys are going to be able to take time to give an update. So I just didn't want to have anybody worried about you or your health tomorrow, since we likely will not be here with you. If somebody else can fill in for me, I'm working on another project that I've got to turn my attention to, so I apologize for not being here with you tomorrow, but just in case we're not here, you're okay. And
if I'm not on Twitter, that's a problem.
That's the concerning sign. Okay, so
yeah, so if I'm fine, I'm on Twitter. So
yeah,
doing my COVID-19 numbers there.
With that said, here is Garrett's Twitter account. It's at Garrett_Archer. Have things been okay over there lately, Garrett? I know it's heated.
Oh, it is what it is. There's a lot of stuff that people have a lot of questions about going on now, but it has calmed down as of late. So
okay, good deal. That's at Garrett_Archer. My Twitter account is at Katie Rammel, and you can also find me on Facebook. Since so many of you are watching here with us on Facebook, you can find me at facebook.com/news from Katie, where the conversation from this always continues over there, and I try to pull some of your questions and make sure we have time to answer those as well. Judy writes, thanks for the great information. You are so welcome. We're happy to provide it. Hopefully you learned something here today and you're able to find the information for yourself. Look at that cute picture too, all those cute kiddos there. Andrea writes, get well, Garrett. So yes, thank you to Andrea for writing that, and we're all sharing those sentiments with Andrea that you feel better soon. So let's see. So Garrett provides an update in the late morning hours, so you can kind of see the numbers just in case we're not here with you. If you need any Arizona school updates, you can find those at abc15.com/schools. Of course, all of our coronavirus reporting can be found in one place at abc15.com/coronavirus. Lots of newscasts coming up. One's in progress just behind the curtain over here right now. So our 4 o'clock newscast, our 5, 6, 6:30, 9 over on the CW61, our sister station. I'll be doing that for you tonight. The 10 o'clock newscast as well, all places that you can find our very latest coronavirus reporting. So with that said, in the meantime, everybody, be safe out there, and we'll see you back here very soon.